The anti-phospholipid antibody theory suggests that a lot of experts are believing this is that women who have a history of recurrent immunological miscarriage have a higher disposition, higher level of these anti-phospholipid antibodies, which is what triggering the miscarriage to happen over and over. So anti-phospholipid antibodies are antibodies that target phospholipid bilayers that are present in the membranes of cells. So they are very core components of autoimmune disease because they target the cells of the host, your own cells itself. So one of the most distinct autoimmune diseases is lupus, which is also caused by antiphospholipid syndrome. So antiphospholipids, on paper, it does make sense that antiphospholipid will target these women who have a recurrent immunological miscarriage history, have a higher level of antiphospholipid antibodies, and they will these antibodies will target the fetus during its during its growth stage, leading to an autoimmune response and leading to a miscarriage. But one crucial mistake and component that they are missing is that they do not know about the presence of a fibronectin layer. According to the patents of Dr. Chen Fengling, these fetuses, when they are growing, right, they are lined with a fibronectin layer, which is a glycoprotein and has a selective diffusion properties. You can assume that the fetus is your hand and the fibronectin layer is a glove, and then you submerge your current hand with the glove into a water, and you can see that your hand is still slightly wet but mostly dry. So this is the function of what fibronectin is doing to this embryo. It's a protective layer, so it prevents anything that is too large or dangerous to be exposed to the embryo. So things that can go in are such as nutrients such as carbon dioxide, oxygen, amino acids, glucose, fats, and more nutrients that this baby needs. And what can exit is all the wastes of the baby, such as urea and carbon dioxide. What cannot enter is anything too large, for example proteins. So if proteins cannot enter the this fibronectin layer, immune cells have no chance at all. So the theory to say that antiphospholipid antibodies, which are significantly large antibodies, have no capability of traversing this fibronectin layer and directly exposing themselves to the fetus, killing it. So this theory is invalid. The real reason why immunological miscarriage happens is because of the damage done to these fibronectin layers caused by anti-embryonic antibodies. Anti-embryonic antibodies are nuclear antibodies, ANAs, and they are very tiny and very small scale, and they are so small, and this gives them the unique ability to trespass this fibronectin layer, directly entering these embryonic cells and interfering with the cell division, targeting chromosome 2, preventing the formation of the fibronectin layer. So women who have a history of immunological miscarriage, they are most likely have a high level of these anti-embryonic antibodies. Anti-hospital has not only determined the cause, we also have determined the effective cure to treat these anti-embryonic antibodies to give you a successful pregnancy. If you'd like to find out more and our customers' previous patients' testimonies and more treatment that anti-hospital offers, please click here in the link.